Our next speaker is Erica Gerrity. She's a licensed clinical social worker whose present and past work all confirm her devotion to helping families and communities imagine and reach their potential. She's currently a psychotherapist in St. Paul and is a founding member of the prison Doula program at Shakopee Women's Prison. This morning, she'll be sharing information and stories with us about her work with incarcerated women and their families. Please welcome Ms. Gerrity.
So I would so much more prefer to be teaching a parenting class in a prison today or attending the birth of a pregnant woman than giving a public speech. But I am very, very grateful for the opportunity to talk about this issue, which is very meaningful to me. All right, I hope after I talk today, you'll learn a little bit more about the scope of pregnancy in the context of incarceration, about the health disparities faced by this population, and the role of a prison doula, and how our project has really dramatically improved the birth outcomes for infants born to incarcerated mothers. All right, so Dr. Schlafer this morning was talking about some national statistics, but I want to try to get at how many pregnant incarcerated women are giving birth each year. So we know there's over 200,000 women in adult jails, state prisons, and federal prisons, probably more around like 230,000 or so, and that there are about 14,000 girls in adolescent detention centers. And on average, 6 to 10% of those women enter facilities pregnant every year. So that means, and like Dr. Schlafer was saying, no one keeps statistics about this, the amount of pregnant women. So these are our best estimates. And one of the reasons our program keeps a lot of data and research is because we're trying to add to that body of information. So we estimate that between 12,840 and about 21,000 women give birth incarcerated every year. Now, this does not include women and girls who are in, and there's not a lot of talk about girls in general, but girls do give birth incarcerated each year. So this doesn't include women and girls who are in treatment centers, court-mandated halfway houses, on home arrest, and also people that are in the federal detention centers for immigration violations. Okay, so before I get into more about our program, the polling question is, what percentage of births in America are by cesarean every year? Let's see. The answer is 32%. So 1/3 of births every year are by cesarean. That'll be important coming up. So where did the idea of a prison doula project come from? In 2003, I was working as an intern there when I was in graduate school. And I would see this group of pregnant women. They would meet once a week, and the group wasn't being taught by anyone who knew anything about prenatal education. In fact, it was another undergrad intern who would sit in the group and look pretty overwhelmed by the fact that all the women were crying through the whole group, and she really had no idea what to teach them. And then the women would come back from the hospitals, and they would sit in the group, and there was no meaningful conversation. And in fact, it depressed me, and I could only imagine what those women were going through. Obviously, they were showing a lot of clinical symptoms of depression in pregnancy and postpartum. And depression in pregnancy is really important because it has negative developmental implications for the baby and for a child as they get older. So I started to think, well, I thought we could do better than that. And I thought, who is an expert in this area? And so I reached out to this community-based nonprofit that has been offering doulas for low-income women for a long time, and it's called Everyday Miracles. And I asked them if they would be interested in working with me to create a project at Shakopee Women's Prison. And they said yes. So that was a long time ago, and it took about 3 years to develop the program and to find some good staff and to train the staff, and then to enter into conversations with the facility to see if they would be interested in even offering a program like that. And as you can imagine, it was kind of a new and radical idea, and we needed to talk a lot about what would the risks be, and also the facility has a no-touch policy, and so how do you teach birthing techniques and attend births and help women give birth without touching them? And so we negotiated that there would be no touching in our groups, but at the birth, the doula would meet the woman and the officers, and for the time she was in labor and that day of birth, they would allow us to touch. At the time, I didn't know, but there are 4 other prison doula projects, and they are in Olympia, Washington, Western Massachusetts, and Florida, and then the other one is in San Francisco. It just opened. And they all kind of have different orientations. I would say a lot of them are very, what's the correct word? Reproductive justice oriented. And then there's some that are more of a medical model, and the medical model one has a very Christian orientation. And our project, because I was a social worker, there's more of an emphasis on programming and mental health and research, I would say. So what is a doula? I don't know if everyone is becoming familiar with that term, but a doula, it comes from the Greek word, it means a woman who serves, but what it really is a trained and experienced professional who provides continuous physical, emotional, and informational support to mothers before, during, and after birth. And the research shows that if a woman has a doula attend her birth, she actually has a shorter labor with fewer complications, that the babies are healthy, and that they have a better success with breastfeeding. So what is a prison doula? A prison doula is a very important person in the life of an incarcerated pregnant woman because she becomes the primary source for prenatal education, emotional support during pregnancy, and physical comfort during labor and delivery. Prior to the Prison Doula project, unfortunately, the woman would go to the hospital on her own, and she would give birth on her own, and she would have no family or friends there with her. There would be 2 officers watching over her. And as you can all imagine, that doesn't make for the most positive or successful birth outcome because we're talking about people that have a strong history of trauma and abuse, and the personal nature of birth and how private it is, and to have 2 strangers who maybe you've never met before watching you do that, and then trying to get through it on your own, it really creates a lot of barriers and can almost be re-traumatizing for women. So a prison doula helps really change the environment, I would say, in the room. And what the officers have told us at Shakopee is that it's helping them because before, they didn't feel like that was a good process either. I mean, can you imagine how helpless it would be to just stand and watch someone give birth and not be able to touch them and not be able to offer them support? And so the doula comes, and the doula can kind of bridge the gap. And so many of the doulas are here today, and I'm so grateful for that. I'm looking at them right now. And so we can talk to the mom, and the thing is, a baby is being born, and we want that baby to be born into a world of, with hope, a positive environment, and respect. That baby did not commit that crime. We don't choose who our parents are. And we've really seen that the officers in the room, they really appreciate that, and they also are able to kind of shift their behavior during a birth. And when we first came, we would see officers watching TV a lot, and I think that was their attempt to kind of escape how uncomfortable the environment was. And now what we see happening is the officers are very quiet. The male officers will often step aside or shut a curtain if the woman's being examined. And then at the end, I don't know what all the other doulas would say, but my experiences have been that we kind of become like this little team. And at the end, we're all looking at the baby, even the officers, and kind of like talking about what's great about it. And it becomes a positive experience for them as well, I think. And then we try to help the mom bond with the baby, considering that there are certain parameters and prison policies, like, for example, women have a soft restraint applied after birth. They're not shackled in labor, but so they can't get out of the bed and move around that easily. I mean, they can ask, but we kind of can help with some of that and help with the baby and help establish breastfeeding. And then a big part of our role, which is what a lot of the women say is the most important part, is that they go the day the baby is taken away from the mother, and they stay and sit with her that whole day. So what happens is the baby, it usually goes with a caregiver, and the caregiver is, more often than not, the maternal grandmother. Sometimes it's the paternal grandmother. Sometimes it's a family member. Like, less than 25% of the babies are going into foster care, which I think a lot of people kind of assume is the norm. And then after that, it all happens very quickly. The baby is kind of whisked away, and the woman is left, as you can imagine, very, very, very bereft. And then she's shackled and brought back to the facility. So the doula stays with her during that process, and then we walk with her out to the parking lot where she's transported. And then we see her within the next 3 days after she's given birth to check in on her. And then we follow up with her in the next couple weeks to further monitor, I would say. All right, I'm going to talk a little bit about health disparities for incarcerated women. So, let's begin with mental illness. As I talked about a little earlier, there's very, very high rates of depression, substance dependence, and also a history of trauma. 64% of moms have a history of substance abuse. And in our groups, about 69% of women report a diagnosis, or they actually have symptoms within the clinical range of depression at the beginning of our groups. We're talking about pregnant women and new moms. And then physical health as well, particularly gynecological disease, HIV, and hepatitis C. Women, so of course, most people kind of know that prisoners have higher rates of HIV, but actually women have even higher rates than male prisoners with HIV, rates that are 3 and 4 times the general population. And there aren't policies in the nation which mandate pregnant women be tested for HIV, and that's something we're trying to work on this year. So, as you can imagine, if there's that much health disparity, it creates a lot of risk for a baby not being born with a healthy start to life. And 1 second, I'm gonna actually read from some notes. I have attended a few births at the prison, and we go, the first visit, a prenatal visit, we meet with the mom, and these are some of the things she told me in the first visit, and they're gonna sound pretty intense, but I tell you that this really is the experience of a lot of women in prison. This woman was 30 years old, and she was gonna have her 4th baby. I asked her, the first visit we say, very broadly, we're trying to build a relationship. Can you just share with me some of your questions or concerns you have about pregnancy? Let's just get to know each other. And this is what she said. My last baby was born 7 weeks early, and it was born on my front lawn while I was waiting for an ambulance. I'm experiencing pain in my cervix right now, and I'm 36 weeks pregnant, so I'm feeling nervous about that. I haven't had a glucose test yet for gestational diabetes, which also makes me feel nervous. I'm putting myself on self-imposed bed rest to try to keep my baby in a little longer because I'm scared of not having her inside of me anymore. I'm having pains in my back. My stomach hasn't been measured for the past few months, and so a lot of people here probably aren't from the birth community, but the reason we measure people's stomach is to check to see if the fetus is growing in a healthy way. And she was telling me that she hadn't had her stomach measured in many months, which would make her feel concerned, right? Because she wouldn't know if her baby was growing in a healthy way. She also said that my labors are very fast. The longest labor I've ever had was 3 hours. And last time I dilated from 2 centimeters to 10 centimeters in 1 hour. She also told me I'm very worried about a hold being placed on my baby because I have a history of child protection. She said she was scared of having an epidural, that she really preferred to have a natural birth. She didn't want anyone to touch her during her labor, but she wanted me to stand next to her, and she thought that would be helpful. She said she wanted to cut her baby's cord. She said she was very scared of leaving and coming back to the prison without a baby in her arms, and she didn't know how she was going to deal with that. The way she was coping with it, she told me, is by not thinking about her pregnancy or acknowledging it and intentionally not bonding with her baby. She said she really wanted the baby to go with the father, but he wasn't an option because he was schizophrenic and he was suffering from a drug addiction right now. And she said so her second choice was for the baby to go with her mother, but that would mean that her 13-year-old son, who was living there, would have to move out of the house because he had a record. And when I asked what his record was for, she said he had an assault charge because when he was in special education classes, he had yelled in his teacher's ear, which triggered an assault charge. And so now he had a record. So for the baby to go live with the grandmother, he was going to have to move into a different family member's house, which gets at what Dr. Schlafer was talking about, which is all these transitions for children. All right, so after all that planning, we came to develop a program that has two core components. We have support and education groups, one for new moms, people who've given birth in the last year, and a statistic for that is that 25% of women have given birth in the last year or are currently pregnant. So the population of Shakopee was 642 yesterday, so that means about 660 women fall into that category. And then our second group is called Mothering Inside, and that's for mothers of children all ages. Anyone can attend, kind of regardless of their crime, and the only criteria is that you have to want to improve your skills as a mother, and you have to have a role in your child's life now. And then the second core component is our doula program. All right. Our groups meet every week for 2 hours, and they run in 12-week sessions or quarters. People can take the groups for repeatedly, and it's pretty common for the pregnant moms to be in our groups for about 1 year or as long as their sentence is. And then along the way, as you can imagine, there's not a prenatal education program for incarcerated women, so we kind of developed our own. And then we also developed a parenting program that's specifically designed for incarcerated mothers. And there are many parenting programs available, but often I feel like they don't take into consideration the unique emotional needs, and particularly the grief and loss that mothers are experiencing while incarcerated. I'm kind of taking a long time, so I'll skip through this a little bit. The doula program, I talked about that before, the primary role of the doula. We have 2 prenatal appointments. We attend continuously the labor and delivery, and for up to 3 to 4 hours after the delivery, and then the separation visit and the postpartum visits. And that's a little picture of all of our staff. We have a very interprofessional team of doulas, social workers, nurses, public health workers, students, university partners, and even our very own prenatal yoga instructor, which the women love. All right, so our very first group began in January 2010, and the prison kind of offered us that we could teach a group for the first year, and if they felt like what we were offering was beneficial to the women, then they would consider if we could offer doulas. So that's what we did. And then on November 2nd, 2010, Meg Novak is here. She attended the very first birth of an incarcerated woman in Minnesota. This is very important because we kind of consider this to be a benchmark or a transition year. In the first year, there were 11 births, and 7 of those babies were born via cesarean. So when you look at the national statistic for cesarean, that's double. And some of the reasons for that is that the women were saying, if you get a C-section, you can be with your baby for 3 days in the hospital versus 2 days if you have a vaginal birth. And that sounds pretty great, right? And there wasn't good prenatal education, and I don't think people really understood that there are a lot of risks associated with cesarean. So we started to create a culture where people were much more informed about their birth choices and opportunities, and what the risks were for themselves and also for their babies. Right? And then, let's see, what's the date? Around the fall of 2011, that's when we found Dr. Schlafer, or she found us. We started to really rigorously evaluate what we were doing. So I had been a social worker for about 10 years at that point, and I wanted our program to have an impact. I wanted to know that if we were working really hard to raise all this money and spending all of our time in the prison, that it actually was improving people's lives. And so we created some measurement tools, and we got a grant from the Clinical and Translational Science Institute from the University of Minnesota with an emphasis on health equity and partnerships between university researchers and community-based organizations. All right, and these are the tools that we started to use. We do an initial survey, and then we do a final survey, and it measures things like mental and physical health. We do a post-birth survey, and then the doulas also have a piece of the research. They document through case notes, they write a birth report, and then they write a story of the birth. All right, so between October 2011 and December 2012, 48 women participated in our project, and 19 were pregnant and matched with a doula. And this is a little contrary to what Dr. Schlafer was saying. She was saying that people have low levels of education, but in our group, people really had almost a high school diploma. We've had people who are nurses in our group before. It's not just people that have come from a background of poverty. All kinds of people go to prison. Average participant was 27 years old. These are the main findings, is that women reported significantly fewer depressive symptoms. They reported more confidence as a parent. And then the finding, which really surprised all of us, is that women were reporting that they were getting more positive support from prison staff and that they were more willing to ask other women in the prison for help. So in the prison, what happens is if you're pregnant, you can go to any living unit. You might never talk to another pregnant woman. So our group was the only opportunity for those people to come together and share those experiences. And then a lot of women ask questions like, well, tell me what happened at your birth. Did this happen to you? Did you get strip searched? Did this? And so I think they were learning that there were valuable resources in each other and more willing to reach out for those. All right, so this goes back to the C-section, right? So in our first 11 births, there were 7 C-sections. And in the last 29 births, there was 1 C-section. Our C-section rate was 3.4%, which still really baffles us. We were pretty amazed by that. We would have never anticipated that. And then the other thing that we're very, very proud of, because it is one of those determining factors of a healthy start in life, is that none of the babies ever born in our program have been of low birth weight or premature. And that's pretty amazing. Last spring, one of our doulas was having a baby, so I was teaching the group every week. There were 5 women who were getting ready to give birth. None of them had ever carried a baby to term. Never. And all of those women had a full-term baby, and I was blown away by that, just absolutely blown away. And women go into labor early. They go into labor and they go to the hospital, and for whatever reason, they don't end up having their babies. So one way that we help support them is if we know someone is having contractions in group, we kind of come around them and give them suggestions about what they can do to help manage that. And then we had a woman go into labor at 25 weeks recently, a little while back, and it happened during group. And then in group, we kind of had a little moment of silence for her because the chances were that if that baby was born, it would not survive. And that's very meaningful to see the women crying and being very connected to that. And everyone said a little prayer or whatever it was, a good intention for her. And then lo and behold, next week she came back to the prison. And she went on to have a very chubby, beautiful baby at 40 weeks. All right. I talked a little bit about birth outcomes, which are low birth weight and prematurity, and they really are predictive factors of lifelong health, including things like cognitive and developmental disorders in childhood, and things like health for the rest of your life, longevity, like cardiovascular disease, respiratory disease. So we want babies to be born healthy. We also want them to be born healthy because premature babies are very, very expensive. The cost difference for a mom and baby in the first 2 or 3 days in the hospital is $50,000. It's about between a preterm baby and a full-term baby for the first 3 days of life. All right. So we really believe that our data suggests that incorporating doulas into prisons can be a promising approach, particularly to improving health outcomes for their infants. Some of the limitations of our study, one of the things is that there's been no data recorded for the last, as long as Shakopee Women's Prison has existed, no one knows how many babies have ever been born there or what their outcomes are. So we don't have any other way to measure the change other than that first year of our group. But Dr. Schlafer's working on it to try to find another prison in another state. But I was reading some data and it really said that people believe that there might only be 3 or 4 programs in the whole country that collect data on this. All right, and our next step is that this fall, the beginning of next year, we're going to extend doula services to Hennepin and Ramsey County in Minnesota. And we really, really hope by 2020 we could have every woman who's giving birth incarcerated in the whole state of Minnesota could have access to a doula. Questions? sure.
Did any of the babies go home with the biological father, or did any of the biological fathers have any involvement in the pregnancy and birth?
Like, they can't have an involvement in the pregnancy unless they come to the visiting room. And in our groups, we do have mothers who their children are being cared for by the biological father. Let me ask the doulas, do you guys know of any babies that have gone home with a father? Ray is saying yes, she thinks so. It's not a common occurrence, but I think it does happen, and we hear a lot about fathers being the primary caregivers for even like up to 4 children. And then women in group talk and they say like, oh my gosh, you trust your husband? And the woman says, how do you know if he can do it if you never give him a chance? I'm really surprised, he's doing a good job.
Hi, I was just wondering, what percentage of incarcerated women at Shakopee who are offered doula services, who are aware of them, accept it, and what percentage say, no thanks, I'm not interested in that?
Yep, so it's totally voluntary, and since the beginning of the project, no one has said no.
So I have co-facilitated the classes with Erica, and I was remembering a time when a mother was tearful, and the reason she was tearful was that her son at school was in like a career day, and they had each child get in front of the class and say, what does your mom and dad do? And the child had to say, you know, my mom is in prison, and deal with that, the repercussions of that. And so I thought, could you talk a little more about the fact that most of these women have other kids at home, the separation of the moms from those kids, and more about what we were talking about this morning in terms of how we can help keep those kids with their moms?
It's such a good question, Crystal, because we can offer women all kinds of great programming, and I think we do, but one of the primary things we do is we just let people grieve. I mean, women are absolutely broken-hearted about being away from their children. And they even say things like, I don't think I can survive this. This is a torture that is physically painful for me. And we see people having very significant mental health symptoms because of this, particularly the women who've had their babies that recently gave birth and then come into the prison. It's not uncommon because many hospitals actually do checks for warrants when you get admitted to a hospital, and so there's many women who have gone to give birth and been arrested leaving the hospital with their newborn babies, and so it's not something they're anticipating, and then they enter almost into like a somewhat psychotic state when they get to the prison, and they are searching for their baby, or they talk about like just wandering around and being somewhat delusional, or like just wanting to sit in like corners so they can feel like protected. It's very intense, and so the point is great, Crystal, that though we can spend all this time doing all this research, I would say the best work we do is just listening to women's stories and honoring them and teaching them empathy for one another. And that's a great outcome of doing groups, because at the first week of group, I'll be like group facilitating and listening to someone and empathizing and like reflecting their feelings. And then by the end of group, I don't even have to do those things because the other group members are all doing those things. They're doing my job for me. And then I see them in the halls at the prison. Like I was walking in one day and I saw this newly pregnant woman coming out of medical crying, just walking. And then I was gonna go talk to her, but before I could get to her, another member of my group beat me. And she was sitting in the hall and she was saying, it's gonna be okay. We have this really good group here and we have this great doula program. You won't have to do this by yourself. To which she said, oh my God, I do not get to have my mother present at my birth, which led to a lot more tearfulness. But she sat with her for a long time and talked to her. And so I think we're just a few people, but if we can teach other women in the prison the skill of how to empathize and give other women support, then our project has much bigger reach. I guess one more question.
I have
then
one
we'll-
last question. Do you find most of the women project that they will not tell their babies where they're born? Most women I meet tell their kids that they're away at college or
I would say
transferred
not
to
in my
another
group.
state.
I'm a
No.
very strong proponent of being honest with your children. And I talk about it from an attachment perspective. Like, trust is so important in attachment, and if we're entering into lies with our children, they're gonna start to question, like, what else has my mother not been honest about? Because they're all gonna find out. And that's what Mona was saying yesterday, like, come on, they're all gonna find out. They hear people talking in their environment, and then often I coach women to talk to their children, and then they do, and then they're so nervous about it, and they come back to group, and then they say, oh, they knew already, you know?